The simulation video was of a young homeless mother that was being prepared for discharge by her nurse. The nurse was in the room to review discharge instructions with the patient. Initially, the nurse is short with the patient and cutting her off before she can answer the questions that she is asked. The patient mentioned that she was homeless early in the conversation, and the nurse did not seem concerned about baby or mom's safety. The nurse in the video was not compassionate toward the patient's home situation, and that multiple times she stated that she was homeless, and the nurse did not stop to dig deeper into the situation. I would have wanted to know more about her plans to care for the baby without a home, or in a hotel, or wherever she plans on taking the baby. Does she have a support system? Has she thought about, applying for assistance or any of those options in order to provide the best care she can for her baby despite being homeless? I would have wanted to know, again, if she had a support system in place. And according to our readings, homelessness is not just living out of a street, on the street, or out of your car. It is also classified as hotels, shelters, or a friend's house. It would be important to know the exact living situation mom is planning on keeping the baby in so that you as a nurse can provide the appropriate resources to her. In the Richmond area, there are health departments and the Caravan that complete well baby checkups. These are all things she will need to know about in order to have the baby go for her monthly checkups and make sure she's doing okay. The mother also tried to look for praise by saying, "Isn't my baby cute?" And the nurse showed little compassion to her about the baby. Compassionate care is a relational activity that is about the way we relate to others when they are vulnerable. At this point in the conversation, the nurse could have taken a moment to be proud of the mother for having a healthy, cute baby and encourage her to follow up with pediatricians as required so that the baby continues to stay healthy. I would have wanted a case management consult to evaluate her and discuss community options for food, shelter, and free clinics in the area. Mom will also need to follow up afterwards to make sure everything is healing properly after delivery. Toward the end of the discharge teaching, the nurse discusses Motrin at home for pain. Clearly, the patient stated a problem with Motrin, that it makes her stomach hurt, and the nurse told her that she would have to follow up with her doctor in 2 weeks about trying something different. Obviously, this is not going to work because in 2 weeks, she probably won't even be taking pain medicine. She will need to be discharged on the correct pain medication right away. It would have been more appropriate to find out what non-narcotic medications have worked for her in the past and review with her the importance of taking pain medications that will not cause drowsiness so that she can care for her baby properly. I would have reviewed what pain is normal and what pain she would need to seek a doctor for immediately. She also could have reviewed with the patient that Motrin is best taken with food so it does not cause an upset stomach. She also could have made the follow-up appointment for the patient since she is homeless and may not have access to cell phones or internet. The nurse's priority seemed to be getting the patient discharged as fast as possible due to what a busy day it had been in the hospital and limited room availabilities. I don't think that the patient was ready for discharge, as she stated many times that she was homeless and she was having concerns about her pain medications as well. The nurse seemed to be passing her off and just hurrying her through the system so that she can move on to the next patient. It is very easy in today's fast-paced nursing world to get caught up in the craziness of the hospital and continuous admissions, productivity, and all those other numbers that we are thrown at with daily. But we have to remember to slow down, listen to our patients' needs, and be better advocates for what is best for them at that moment. Without doing these things, we are not doing what we are truly called to do and taking care of our patients in the way that we all should. This nurse clearly did not practice compassion that I know each of you probably give your patients daily. But sometimes you're having a bad day, and it is so easy to get lost in the moment and lose some of your compassion, especially to drug seekers. I work in a busy ICU where we see lots of drug seekers, and it is very easy to become, judgmental of their lifestyle and their pain. Is it true? Is it not true? And it's very hard to sometimes separate those feelings. But when you see it in a video like this, it really did put it in perspective sometimes of how you sound when you talk to a patient, and how you present yourself, and how it's really not helping the patient regardless of her history. So